Okay, so we have just a little introduction to the theory behind the Motus. To remember that in our Motus device we have we have two versions: the only Alexandrite laser or Alexandrite Nd:YAG laser. The reason we need Alex and Nd:YAG is due to the different absorption from the melanin, which is in this case is our main target, because we want to treat hairs, so we want to do a removal which are rich in melanin. So in this case we choose a laser, which is the Alexandrite laser, which shows an higher absorption from melanin than the other type of lasers, including the Nd:YAG. This is true and is suitable when you have to treat skin type 1, 2 and sometimes 3, because there the quantity of melanin present in the skin is much less, because you are a light skin type. So the competition between the melanin in the hair follicle and the melanin present in the skin allows us to treat the hairs in a safe way. Otherwise, when we move to darker skin, 3B, 4, 5 and so on, you have a quantity of melanin which is in competition with the hair. So if you shoot to the skin in order to target the hair, you also target the skin, and then you burn, you cause a problem to the patient. In this case, normally we were, let's say, used to move to the Nd:YAG, because there you have less absorption and it's a safer wavelength to treat the darker skin. I can tell you that with a particular technology we have in our machine, we can also treat the darker phototype with the Alexandrite. We have a long experience on that. We have customers in Saudi Arabia, in Kuwait, Iran, all the Middle East. We treat safely the darker skin even with Alexandrite. And also we have the plus that by using the Nd:YAG, we can also catch the last peak of the hemoglobin, so that means we can also do vascular treatments. So it can be used for both uses. So depending on what is your target, how you run the business, if you are focusing on a device for hair removal, then only Alex is fine. Or if you do not have so many patients with dark skin. Otherwise, you could add the Nd:YAG and do also the vascular treatments. Not only this, but we have to remember that according to the different wavelength, we are able to penetrate deeper or stay more superficial into the skin. This is because mainly due to the absorption of melanin. Of course, if a laser is well absorbed by the melanin, even a smaller quantity blocks the laser at a certain level. If you are less absorbed like the Nd:YAG, the laser can penetrate deeper. And that's why the laser Nd:YAG is also suitable for treating the leg vessels, because the penetration depth allows you to reach those vessels which are in a deeper layer than other vessels on the face. DEKA device or other devices on the market, you have the device itself and several end pieces. The reason why you need different end pieces is particularly the smallest one, 2.5 and 5 millimeter, are suitable for vascular treatments. So if you are targeting small telangiectasias on the face, you normally use 2.5 and 5. When you do leg vessels, you have to use the 5, for a very simple reason, that a larger spot size penetrates deeper into the tissue. So the larger the spot, the deeper you go. Since we said before, the vascular lesions on the leg are on a deeper layer, then you need a larger spot size. From the 7 on, 7 is mostly used for pigmented lesions, so if you want to treat spots with Alexandrite. 10 to 20, 30, as we have in other devices, is basically a spot for hair removal, depending on the area. Of course, if you want to treat the back, the legs, or larger area, you tend to use the bigger spots because you want to be faster. If you have to treat some part of the face, the axilla, the bikini area, then you reduce the spot size to match the area. The issue with that is, before we introduced the Moveo, was that for an Alexandrite laser, you have to use, let's say, 14 joule per square centimeter, 16 in the light hair, blonde hair, fine hairs, which results to be quite painful. for the patient. So some of them, they even do not come back because they can't tolerate the pain level, especially when you treat bikini area or other sensitive areas. It was too painful. And the same for Nd:YAG, because in a skin type 1 to 2 you have to use 40 joule because it's less absorbed, and then it was quite painful, and also was risky because 14, 16 joule, you are on the edge of creating burnings to the patient. So not only discomfort for the patient, but also for you, it was a little bit tricky because you are always at the limit to create a burning. So we introduced a new handpiece, which is called the Moveo, and the Moveo is using a completely different concept, which is, this is the handpiece. With the Moveo, what we did was to, first of all, introduce a contact cooling. We have a Sapphire which is cooled down by the machine, so that keeps the level of pain to a minimum, actually painless treatment, and also preserves the skin, so you can't burn the patient's skin due to laser emission. Now, when you work with traditional spots, what you do is you start and you do one shot, and then the other one, and then the other one close to another at the threshold energy. With the Moveo, what we do is we use a much lower fluence. I told you before, normally you use 14, 16 joule. With the Moveo, we use 6 joule. So at 6 joule, it's impossible to burn the skin. There is no way. But we move the handpiece. We slide the handpiece several times over the same area until we increase the temperature of the hair follicles, and they are destroyed by the laser. So it's a different concept. It's a much safer and easier concept, even for you who have to use the machine, because in this way you are very confident you cannot cause any burning, any damage to the patient, unless you stay still in the same area for 2-3 seconds. There, of course, you cause a burning, but it's not meant to be used in this way. So the way of using the Moveo, very simple. We determine an area which is about 10 by 10, like Onda. We determine an area, 10 by 10 in this case, is normally about one hand. So if you place the hand over the patient, you know you have to stay here. We select the right settings depending on the skin type, but changes are very minimum. So we set the fluence, normally is 6 joule from type 1 to type 3, and 4 to 5 joule for type 4, type 5 skin type. Depending on the skin type, we have 3 pulses, which, let me see, okay, it's here. We have a soft, normal, and high peak. Soft, of course, is a more gentle pulse, and it's suitable for the darker skin. If you, on contrary, are treating a light skin, then you need high peak of power to target the blonde hairs, the fine hairs. So then you set the high pulse. And if you are moving from areas where it's well tolerated to sensitive area like bikini area, then you switch to normal just to lower a bit the feeling for the patient, and that's it. Then you don't have to adjust anything else. So it's quite simple procedure. We have the frequency to be adjusted 3 or 5 Hz. For large area we use 5 because you want to be faster. 3 it's used when you move to face or other areas where they are not completely flat and you can't keep a good contact with the skin. In this case, it's better to go slower because even if you do something wrong, nothing will happen. I mean, it prevents some damages. That's it. So fluence, the speed you want, and the type of pulse according to the skin type. Finally, like in Onda, we set a dose per the area of 10 by 10, depending on the skin type. Normally 1 to 3 we deliver 2500 joule. For darker skin, 1000 to 1500. So we lower the dose. You start the treatment, the machine counts the dose you deliver. When you deliver the entire dose, the machine stops you and you can immediately go to the next area. So you deliver the energy, then the machine tells you it's over, and then you move to the next. So it can be easier than this. It's very simple procedure, very fast, safe, and it's completely painless. So we made finally the use of alexandrite safe, and it can be used on any skin type, whether it's dark, whether it's light skin. You can safely use the alexandrite laser if you want. If not, you switch to the Nd:YAG and you do treatment with the Nd:YAG. Last consideration, why, if you have such possibility, why you should use the traditional MPCs? For a very simple reason, because after several treatments, the hair will grow back, some of them. And normally, for any device you use, whether it's it's another machine, it's diode, it's IPL, when they come back, when they regrow, they grow thinner and lighter. So with less melanin into the hair follicle. These type of hair are very difficult then to be treated because they are very light. And in order to complete the treatment, in order to finish and make the patient satisfied, then you need to switch to the traditional technique, which offers higher peak of power, higher energy, and it's the only way to complete the treatment. So you start with the Moveo, you get very good reduction of hair, but then the finishing of the treatment should be done, most of the cases, with the traditional spots. So this is the reason why we also have these MPCs available in our device. And this is what about the hair removal. Vascular, we can also treat vascular lesions like small telangiectasias on the face with very good results by using the Nd:YAG. We can see some of the pictures here. So by using the right settings, the right way of delivering the energy, you get excellent results. Most of the time you see the vessel disappears immediately. Sometimes it becomes darker or gray. It's fine in both cases. It leads to very good results. With the right settings, you don't have PIH, you don't have hypopigmentation. There are no big risks of damaging the skin of patient. You can treat angiomas, you can treat telangiectasias, even on the wing nose. So you can do several vascular treatments. You can also treat leg vessels. You can treat vessels up to 2 millimeters. Like in this case, you can't treat bigger vessels by using the Nd:YAG. Always remember to use the 5 millimeter for treating the legs, because otherwise you don't see any result with the 2.5, because you don't reach the target. And then you think the fluence is too low, so then you increase the fluence and you shoot again, but actually at the end you will burn the skin without reaching the vessel. This was a common mistake which happened in the past many times. After the procedure with the Nd:YAG, you have, most of the time you see disappearance of the vessel. You leave redness, erythema immediately after for a few hours, but then it's resolved by itself. There is no need of an external cooling, just keep with you an ice pack that you can use after 3 or 4 shots to cool down the skin immediately after. And then you apply ice for 15 minutes and that's it. Then the patient can go back home. As we said before, they can disappear immediately or become darker. It's fine in both cases. This is immediately after. There is a darkening of some of them. Some others are almost disappear, like this one. But at the end, the results, as you can see with the dermatoscopy, is exactly this one. For the small vessels like this, I can tell you, normally you can treat when it's associated with other bigger vessels that you see there is a general issue which can determine this. Yes, it's better to do it. And most of the time in this case you have to do sclerotherapy first, and secondly you finish the treatment by using the Nd:YAG. So yes, some cases better if you ask a consultation before. So you see how it works. It's very simple. You shoot with the laser, the vessel almost disappear, if not becomes darker, and that's it. It's very predictable treatment. You can rely on the parameters we provide to you. I think if we want to stay on a quick introduction, I think that's almost all. It seems a lot of information to digest and many things to set on the device, but actually if we move to the practical part, you will see that it's basically easy. Very, very easy.